Good evening, everybody, and welcome to our Vale of Whitehorse Scrutiny meeting. This evening, we are now broadcasting live as well, so there'll be members of the public watching. I know there was some interest, certainly from the western end of the district in this meeting. So my name is Catherine Foxhall. I'm the chair of Scrutiny for Vale of for District Council for Vale of Whitehorse, and we have just one substantial item on the agenda this evening, but I'll go through and we can introduce everybody now. So if we start then, and I should note that this this meeting is open to the public, including the press. Members of the public are entitled to speak at this meeting, but I don't believe we've had any requests for public participation this evening. So to start the meeting, to talk about who we all are. So I've had apologies from Debbie Hallett, Ben, if you could record these, Debbie Hallett, Ron Batstone, Oliver Forder and Sally Powolowski this evening. And then if I will just go through and say who we've got present in our virtual room this evening. So as I said, my name is Councillor Catherine Foxhall. I'm the Scrutiny Chair. And we have Councillor Judy Roberts, who's our Vice Chair of this committee.
Good evening.
Thank you, Judy. And we have Councillor Hayley Gascoigne, who's a committee member. All right, Hayley, everything, or just you're here. We can see you're here.
Yeah.
We haven't done one of these for ages, a virtual meeting, have we? And so we also have, I'm very happy to welcome this evening, Councillor Helen Pighills, who is our Cabinet Member for Community Health and Wellbeing. Helen, thank you for joining us this evening. Cabinet members aren't allowed to be members of the Scrutiny Committee, but as this is an informal meeting, Helen, you're very, very welcome to ask any questions if you want to, as far as I'm concerned. We also have on the call this evening, I can just see Deborah Dewhurst, one of our other cabinet members, has joined the meeting. You're very welcome, Deborah. We have Adriana Partridge, who's our Deputy Chief Executive of the Council for Transformation and Operations, and she also oversees wellbeing within the Council. So thank you, Adriana, for joining us. And we have Ben Silverstone, who is our Democratic Services this evening and will be taking minutes. And we have Susie Royce, who is in charge of the tech this evening, making sure it all works properly. And then on the call we have our guests from, I had it all printed out, NHS Bath and North East Somerset, Swindon and Wiltshire Integrated Care Board. We had Gordon Mavuti, who's Director of Place for Swindon, and BSW Executive Director for Mental Health. And we also have Caroline Holmes, Deputy Place Director for the Swindon locality. And they'll be providing an update, which we'll get to in agenda item 7. So to go through our agenda, so we've done apologies for absence and presence. I haven't had any notifications of substitute members either for this evening. In terms of urgent business and chair's announcements, which is item 2, I would just say this is an informal meeting of Scrutiny rather than a formal meeting, and we just have one item, as I said. But as we're online this evening, it would really help committee members if we could use the hands up function if you only want to ask a question, and that's really helpful because it helps show who's in what order we're in. Please don't write in the chat unless you're having tech problems and not sure you can be heard, in which case do flag it up in the chat. And if committee members could please keep their cameras on through the meeting, that would be really helpful. Thank you ever so much. Otherwise, I don't have any other urgent business I need to report now. Do we have any declarations of interests from our committee members here? No, I'm getting shakes of the head from Hayley and Judy. I would just, I don't have any formal declarations of interest in terms of pecuniary interests or conflicts of interest, but I would just say that I'm the ward member for Watchfield and Shrivenham, so this does affect my ward very closely. So I do have a particular interest in this, but it's not a conflict, I don't think. So because this is not a formal meeting, we won't formally adopt and sign the minutes of the last meeting. Now we'll leave that for the February meeting, but I'm super conscious that is we've got both budget setting and corporate plan in that. So if there are any issues with the minutes from the last meeting, Judy and Hayley, while they're still a bit fresh in our minds, if you wanted to note them now, and then Ben can note them down and make sure they're amended before we formally adopt them in February. Is there anything you wanted to raise from those?
No, I didn't see anything.
No, okay, thank you both.
Fine
That's
by
really
me.
helpful. Brilliant, thank you. Public participation, item 5. We don't have any registered questions or statements from members of the public to our meeting this evening, so that's simple. And then in terms of item 6, the work schedule and dates for all Vale and joint scrutiny meetings. Committee members, you have those items on your agenda, that the table of all the items coming up, and you'll just see, as I've just mentioned, we've got budget setting and corporate plan both coming up at our next meeting in February, and that will be in person in Abbey House, so that will be a big one. So to come on to the main item for this evening, I'm really thrilled to welcome, thank you so much Gordon and Caroline for joining us, and as I said, we've got Gordon Mavuti and Caroline Holmes here from NHS Bath and North East Somerset, Swindon and Wiltshire Integrated Care Board, or more easily known as BSW together, and they're here to present to us a presentation and an update on their integrated community-based care programme, which is going to be informing the recommissioning of community services from April 2025 across their region, which includes the western end of our district, which is why we're particularly interested to hear what you have to say. So thanks ever so much. And Caroline, I believe you're presenting, so over to you. Thank you.
Thank you, Councillor Foxhall. And I'll just share my screen, if that's okay. So just give me 1 second while I just do that. Okay, I'm just going to make sure I can see you all as well. So let me just pop that onto slideshow for you all.
Perfect.
Okay, can I just check you can all see that?
Yes, that's fine.
Yeah,
okay.
Thank you.
Lovely. Now, I can't see you at the moment. So if anybody wants to ask any questions, please do go through Councillor Foxhall, and I'll answer those, and Gordon can answer those as well as we go. Okay, so we are here to talk to you about the future of community services in Bain, Swindon and Wiltshire, and just to explain the process that we're going through at the moment and some of those changes that will be taking place. And as you mentioned, Councillor Foxhall, the area that concerns for you is around the Shrivenham area, which is part of the Swindon locality in BSW ICB. So I just wanted to start off by just setting the scene a little bit for you. So like all of the ICS's, integrated care systems across England, in the last couple of years or so, we have been developing a vision and strategy for integrated community health and care services going forward. And just there you can see our integrated care strategy on a page, and it's fed by our local health and wellbeing strategies, and also our joint strategic needs assessments coming through from each of our local areas. So Swindon as well, you can see there in the middle. And that together, those JSNAs and local health and wellbeing strategies came together to create the vision for integrated services across BSW. And that vision is about listening and working effectively together to improve health and wellbeing and to reduce inequalities. And we, as part of that vision, we have 3 clear priorities or objectives that you can see there, which is a focus on prevention and early intervention. So trying to support people as early on in conditions that they may develop, but also to support them to live healthy lives and prevent developing more complex health conditions. The second one is around fairer health and wellbeing outcomes. So that's very much about recognising that even across Bain, Swindon and Wiltshire, we have different health outcomes for people depending on where they live. Even in Swindon and Shrivenham, there are different health outcomes. So it's very important that we try to minimise those and support fairer experiences for people. And then the third one is very much around excellent health and care services. So that's very much about saying no matter where we live across our different areas, we should all expect the same level and standard and access to health services. So the model itself, we have a diagram that explains our care model as well. And that was developed around about 18 months ago, was the subject of quite significant public consultation and engagement around developing that model. And I'll show you the diagram of that in a minute, but it's very much around supporting people, their communities, making sure that the care and support that we offer is personalised to people. It's not just about fitting people into standard services, very much about their local communities and local teams working within those neighbourhoods and areas. And then thinking very much more about specialist services that will start to become available in people's local communities. And then more broadly, those specialist services that we find aren't available in each of our local areas because they are far more specialist. So we may travel a little bit further for those, for example. So they may be, for example, complex trauma it is something that you may travel a little bit further for. And then underneath, we've got enablers as well within our strategy. And probably those are very similar to enablers that you would also have within the Bob ICB as well, and across your ICS. So very much thinking about how we move our funding models to support more services in the community, and also to support our third sector partners to work within our communities in a more sustainable way, because we know that they often know far more and understand far more about people's local health and wellbeing needs than we do within statutory organisations. There's one around workforce that you would expect, and also digital, so technology. Estates as well, so making sure that we make the best use of all of the estates that are available to us, that we do that in a sustainable way, making sure that we're looking after the environment as we do that, and also being really clear about our role as anchor institutions. And what we mean by that is our role as often very large employers in our local towns and cities and rural areas as well. So we have an opportunity and also a responsibility to model behaviours that we would like to see, and to support through employment and other ways more sustainable communities. So the ICS vision and strategy itself, you can break that down a little bit further into the life course elements of people's lives. So starting with healthy pregnancy, working all the way through to dying well as well, and some real principles there about how we would want to provide services and deliver better health and care outcomes for people across Bain, Swindon and Wiltshire. And on the right-hand side is a diagram that talks about how we are aiming to shift resources really to really invest in our local communities and preventative services, and to support a growth in self-care and community and primary care services. So over time, we know that means we will need to make different decisions about how we invest funding going forward in the future, and we'll explain that in just 1 minute. So if you go down a level further from our ICS strategy, we then start to talk about primary and community care services in more detail. And this I'm going to talk to you now a little bit about the primary and community care delivery plan. And this is a strategic plan it's a bit like a chapter, if you like, in our integrated care strategy. So it goes down into one level in more detail around primary and community care. And it's part of something called the Integrated Community-Based Care Programme, which is quite a mouthful, but it's one of our 6 BSW transformation programs. So transforming our community services is a key priority for us, and it's one of the first ones that we've been working on. And it's also the vehicle for recommissioning our community services from April 2025. So if you hear us talking about the Integrated Community-Based Care Programme, that's what it's referring to, is our vehicle for transforming community services, which ultimately will lead to new community contracts from April 2025. So the plan itself, the primary and community care delivery plan, it was signed off by the ICB board in September. Since then, we've been going out to health and wellbeing boards. We've been talking to our primary care colleagues. We've been working with the third sector, Health Watch and others to test out some of our interventions and actions that are within the plan itself. And because of the time we've got tonight, we won't go into that plan in great detail, but I'm very happy to share that with you, and also to come back and talk about it again if that would be helpful. But just to explain and give an outline view of it, the reason we've developed the plan, the reason we are developing the Integrated Community-Based Care Programme, is because we have a real opportunity where we are now to really transform community services for people living across Bain, Swindon and Wiltshire and Shrivenham within the Swindon patch. So we know that there are also significant drivers that mean that we need to do something different. And if we don't, we know that we will end up with a largely unsustainable health service and health offer going forward. So we have a real case for change, and I have a slide on that in a minute to talk you through. But it will be no different to the Bob ICB as well. So particularly thinking about our, a growing older population, living longer, often more frail, and with many conditions developing at the same time. So that there'll be very similar aspects affecting the wider Bob ICB as well. So during the development of the primary and community care delivery plan, we looked at a range of national strategies and documents as well. So a lot of what's in the plan is taken from national developments, national guidance and national research. But we also put on some market engagement events over the summer. And in those events, we really heard from local providers, carers, the third sector, about what their experiences were of local services and how they felt they could improve and what the priorities for transformation were. And their feedback has helped us to develop the priorities for transformation within the primary and community care plan. And those transformation priorities are on the right-hand side that you can see there. So it's very much about developing joined up local teams. And I'm sure that's something that you will be hearing about much more widely as well, wider than Shrivenham, but across the whole of Vale of Whitehorse and Oxfordshire. Also using population health management, which in kind of plain English is about using data much more effectively to help us pinpoint where we may have health inequalities in particular areas, for example, and different needs that mean that if we can offer a slightly different service in those areas, we can improve health and wellbeing outcomes for people. There's a priority very much around developing preventable models of care as well, and that's very much thinking about what those local communities are and what their assets are. We're aiming to really improve access to services closer to home. So that's very much thinking about some of specialist services that at the moment are provided within acute hospitals, for example, and outpatient clinics, how we can bring those back into our local communities and offer those, and or even as simple as offering advice from consultants to local GPs, for example. And the last one is very much around our what we call urgent care offer. So that's our care that people need on the day that's often unplanned, and how we make sure that we have a much more synchronized and joined up offer for people that's simpler for them to understand. There are 5 focus areas in the plan, which again are unlikely to be of a surprise. So focusing very much on children, young people, for example, mental health, learning disabilities, autism, and so on. And the 6 enablers that we talked about previously also flow through the plan, although we've also added one that you can see there around commissioning and contracting. And that's partly because we heard very strongly coming through the market engagement events that the way we commission some of our services is it needs to be more sustainable going forward. So particularly thinking about our third sector providers. So in terms of delivery, this is a slide that shows you the integrated care strategy within the middle. And then around that, surrounding that, are our enabling strategies on the right-hand side. And on the left-hand side at the bottom, you can see the primary and community care delivery plan, and also alongside it, a number of our other strategies. So primary and community care doesn't sit in isolation to the other strategies that you can see there on the left-hand side, but the ones on the left focus in far more detail. So for the mental health strategy, for example, will focus in detail around the development of mental health services for people across BSW. The primary and community care focuses very much around those community services. So I won't go through this slide in detail. I know you've got these slides as well. So I won't go through this one in great detail for you. But we know that we have pockets of disadvantaged areas across BSW. That's very similar to all integrated care board areas. And we also face a number of challenges going forward that if we don't do something different with the way we deliver services, they will fast become unsustainable, and we will not be able to deliver a good quality care level of service for people in the future. So being innovative and thinking creatively about our services going forward is really critical for us. And this is the slide I was just talking about, which shows you the health and care model, which we developed around about 18 months ago. So you can see the principles on the right-hand side that go into our local health and care model. So very much around people in Bain, Swindon and Wiltshire experiencing a personalised approach, aiming for healthier communities with reduced health inequalities, joined up local teams, which features very strongly in our primary and community care plans for the future, and also looking to offer those more specialist services out in people's local communities. And we know that because of new technology, new virtual technology, but also the way that people are able to monitor their own health conditions means that we can offer a very different type of service going forward than we would have done previously, which also helps people to feel far more in control of their health and their conditions than they may have done previously in the past, and may also have had to have travelled distances in to see specialists for their conditions, when in the future we may be able to offer those either virtually or closer to people's homes. And just on the left-hand side, you can also see how we've incorporated some of those national strategies and guidance documents as well. So in terms of outcomes that we're expecting to see through our community transformation going forward, you can start to see there how we've taken our vision, started to focus on those 3 strategic objectives that we want to deliver, and then those long-term improvements that we're expecting to see. So if we focus on prevention and early intervention, if we really aim to provide and achieve fairer health and wellbeing outcomes for people, and we really focus on delivering excellent health and care services, we would then expect to see increases in life expectancy and healthy life expectancy, but also a reduction in the gap between our life expectancy and healthy life expectancy across our population. And we would also expect to see less variance as well for our health life expectancy, depending on where you live, the wealth of the area that you live in, ethnicity and other characteristics. And just at the moment, we're developing some of those overarching outcome measures to help us measure that as we go forward. So this slide tells you a little bit about what's going to happen in the next 18 months or so around community services. So at the moment, just to give you the background to this, so we have current contracts across 5 providers in Bain, Swindon and Wiltshire, and for community services. And those community services date back to when we had 3 separate clinical commissioning groups. Some are very integrated across health and social care with public health. Others are quite separate. And we have some which are adults and children's services, so all age, and some which are children's only on their own and adults only. And some include end of life and others don't. So you can see we have a real mixed offer across Bain, Swindon and Wiltshire, and a real kind of patchwork of current contracts and arrangements. What we also know is that there's also variation in what's available and what's delivered across our 3 areas. So if you live in Swindon compared to Baines and Wiltshire, you may be able to access some services that other areas can't, and vice versa. So that's something that's very important to us as we go forward and think about those services for people in Shrivenham, as well as across whether you lived in Bath, in Keynsham, in Salisbury, for example. And in Swindon, just for clarity as well, the current community health contract for adults is held by Great Western Hospital, and it serves the Shrivenham residents. Oxford Health, though, provides community nursing services for Shrivenham residents, access to MIUs for you within the Oxfordshire patch, and also speech and language therapy for schools. So those contracts are both within the scope for the re-provision of services from April 2025. And these principles are in your slides as well, so I won't go through those in great detail, but we have developed a number of core principles that we want to make sure are within any re-provision of services going forward. So you can see those core principles there, and we've got a number of core principles, and I won't go through those in detail, but they are there in the pack for you. So just the very last slide as well is just to give you an idea of where we are in the current process. So at the moment, we are just in what's called the pre-selection process. So we have invited providers to express an interest in providing community services going forward. And then, as you can see, over the next 18 months or so, we will gradually tick off those milestones on the left-hand side. September 2024, well, August 2024 is when we would identify our preferred provider, and then September to April 2025, we would be going through the mobilisation and the transfer of services to the new provider, with it going live in April 2025. So I'm just going to stop there. That's my last slide. So just before I kind of invite any questions, I just wanted to check if there was anything, Gordon, that you wanted to add at all.
No, nothing from me. I think it was very comprehensive, Caroline, so thank you. Really helpful.
Thank you. So Councillor Foxwell, I don't know whether, I'm sure there'll be lots of questions, so we're really happy to take those between us.
Thank you, Caroline. That was really helpful and useful. Thank you. Would you mind just, I think yours, I don't know if it's just me, but I've still got your slide up. Maybe
Sorry.
And then we can have a better conversation then. Wonderful. Thank you. Yes, thank you. That was brilliant. I have a billion questions, but Judy was, Councillor Roberts, sorry, terribly informal. Councillor Roberts was straight in with a question there. If you want to start, that'd be great.
Yes, I had two questions at the moment. When you said you went out, you've got a list of contracts and going out to get new contracts with providers. I'm not quite sure when you say providers exactly what sort of health provision they are, and I was wondering who they were, and I couldn't quite see how the GP system fits in with the overall provision. And the third question is your digital platform, and if you could explain a bit more about how you're progressing to implement the digital platform within your health services. So probably quite three big questions.
Sure. Gordon, do you want me to start off?
You can start off, and I can pick up a couple of those if you like. Yeah.
Okay. So, Judy, just in terms of the current providers that we have, so community services in Shrivenham at the moment are provided. Our community services provider for Swindon is Great Western Hospitals NHS Trust, so they hold community services for us. But for Shrivenham, there are some specific elements, including community nursing, for example, that are provided by Oxford Health, and speech and language therapy for children. And I think we also pay a small contribution towards access to MIUs, the minor injury units, in Witney and Farringdon, and possibly, is it Abingdon as the third? I might be making that one up, but three of them definitely anyway. And across the rest of Baines, Swindon and Wiltshire. So in Baines, for example, we have HCRG, the HCRG care group, which provides community services in Baines. And in Wiltshire, we have Wiltshire Health and Care, who provide community services at the moment in Wiltshire. So we have a range of different providers at the moment, and kind of as we explained, they've grown up organically and are a legacy of the time when we were three prior separate clinical commissioning groups. And interestingly, because we've all commissioned largely community services, but in very different ways, the offer is very different for people across Baines, Swindon and Wiltshire, and there are clear disparities in some services. So when we've looked at the three areas and what's actually commissioned at the moment, in some areas, for example, you can't access intravenous therapy in the community. So that's where you can have an antibiotic drip, for example, in the community. So there are different offers wherever you live. So that can affect how long you might stay in hospital for example, or how quickly you might be able to go home. In terms of the GP surgery, so we have Elm Tree Surgery. So Elm Tree is one of our practices within the Swindon locality within the ICB. So it's in one of our primary care networks for the Swindon locality. But obviously it faces out into Oxfordshire for all of your social care services, and into Vale of White Horse for some of those community services as well. So we recognise that what we absolutely need to be doing when we're looking at the needs of people living in Shrivenham is being really clear about how we recognise that wherever you create a line, if you like, we need to make sure that we operate fluidly around and don't let that affect people's experiences of health and care services. And digital, just very quickly. So we are developing, along with very many other areas, an integrated care record. So our organisations across BSW are signing up to be part of that integrated care record, and they're at various different levels of integration into that record. But that's progressing. And as part of the primary and community care plan, it talks very much about how we would start to increase our use of digital opportunities going forward. So apps, for example, but also home monitoring and eventually home diagnostics as well. But that's over a much longer period of time. So if I just stop there, Gordon, I know you wanted to add a bit, didn't you?
Yeah, that's before you answered all the questions, Caroline.
Sorry, I'll let you answer the next one.
No, honestly, it's fine. Yeah, no, it's. I was as you were talking, I was just thinking about the cross ICB element of this, obviously from a BSW perspective, but there's a Bob in there perspective as well. So the boundary issue, for example, particularly if you're talking about things like interoperability and technology and that type of stuff, becomes a lot more complex, doesn't it? Because you're crossing boundaries. So where you might come up with a really good digital solution from your own geographical footprint, the way patients move doesn't always reflect that with that boundary bit, which makes it complex, I guess, is what I'm saying.
Thank you both. I think that was really helpful. Hayley, did you want to? Yep. Go ahead.
Yeah. It's been brought up a couple of times, but I'm sorry if I missed the full explanation of it. But how the relationship works with the Bob ICB, because obviously, and forgive my ignorance if I get this wrong, but obviously before it was Bob ICB, those were separate clinical commissioning groups, and obviously the thought was, I assume, that if you bring them together, it can be more, you're looking across a wider area, more integrated, less of those boundaries like Gordon just mentioned. And then that's thought, okay, well, that's, I don't know, you can think on a more strategic level and move resources when needed. Obviously, there's always going to be a boundary, because otherwise we'll be working at the national level and then you're not understanding local needs anymore. So that just comes back to my point of not just the digital stuff, which Gordon just mentioned, but just generally, like how does the relationship work between yourselves and Bob ICB?
Yeah, so I think the cross ICB relationships work better, Hayley, at regional level across the Southwest, but not as well into Bob. I mean, to be fair, if Nick was here, Nick Broughton, who's now the chief exec of Bob, and was the chief exec of Oxford Health, who I know really well, would say himself that Bob has been through, I think, a really turbulent period, I would say, in the last sort of 18. If you look at the journey of ICBs and how they're formed, some of those basic foundations, building relationships, looking outward, I think there's been quite a lot. It's not a criticism, by the way. It's a lot of this is known publicly. There's been quite a lot of internal issues, I think, that Bob as an ICB has been trying to get grips with. Lots of turnover in leadership. Nick's just taken over, but I think he might be the third or something like that in a short space of time. So I think that in order to start looking outward as an ICB, and start doing some of that cross-boundary ICB stuff, you need to be in a certain place. So for us, BNSSG, sort of heading towards Bristol End, is probably the ICB that we have the closer working relationship with. But I know that Nick, who actually knows Sue, our chief exec, from having worked together in Hampshire, has already reached out to say, it'd be good to catch up at some point to talk about a range of issues, and I'm sure cross ICB opportunities would be one of those. So even things like provider collaboratives, there's quite a few in the Southwest region, so we get a lot of mutual aid from places like Southampton, UHS, Hampshire hospitals, that side of things. Do you see what I mean? So I think there's a lot more to do, Hayley, to be honest, from the Bob side. That would be my take on it.
Thank you.
That's interesting. Just to follow up then on Hayley's question, really, is it seems to me that one way that you can cross these boundaries, and in some sense this is already happening, is through your contracting. So presumably there's no reason to prevent, say, I don't know, a Cardiff service or a Exeter service or an Oxford service, we already have Oxford Health, taking on contracts if they're minded to. Yeah. And that seems to me that one way that you could actually create quite successful cross-boundary partnership working. So I just wondered, when you're contracting, how do you, I guess, is there a risk of us becoming more kind of geographically siloed, or is actually there an opportunity for us for the contracts to overlap to help kind of interlock these different ICBs together?
Well, Caroline, take that. Have you got a view on that, Caroline? I can come in.
So I think in terms of the contracting process, and obviously we're in a live contract process at the moment, so we're limited about how much we can comment on that. But
sure.
We would not, you know, I think I'm just trying to think of the best way to say it. I think that you know, that there are no wrong ways of expressing an interest in providing services. So I think, you know, that's something that we will work through as those expressions of interest come in. I think what we are very clear about, though, and always have been, is that no matter where a formal, you know, governance line might be, we know that the NHS carves itself up, you know, in various different ways, in quite regularly. So there is a view that ICBs and ICSs are going to be around for quite a period of time, I think. So there's a real opportunity for us to build those relationships across the ICSs. And as Gordon has said, we need to be doing some of that work locally between BSW and Bob ICB, and we're really supportive of that and would really welcome that. But I think in terms of our principles about delivery and outcomes for the population, we need to not let that get in the way of you know, those outcomes that we're seeking for people who live in Shrivenham, as well as people who live in Baines or people who live in Salisbury, for example.
Yeah, and just to add, so as you're talking, I was thinking to Oxford Health, for example, if you look at services for children and young people, so Oxford Health provide CAM services, community CAMs, across a BSW footprint and an Oxfordshire footprint as well. And so in that context, you know, there's a uniformity in the way that they provide that service across Bob and BSW, and although they don't do it in BNSSG. So I think, Catherine, it's a really valid point, because I think that's just a small example of where actually you can do that across Bob and BSW. You know, and it just depends how much of an appetite, you know, they have as an organisation for doing more of that, I guess.
Sure, thank you. Adriana, can I just check with you? Are you happy for me to take questions from cabinet members? I know normally it would just be the committee, but is that okay?
Absolutely, your discretion, Chair.
Okay. Well, I shall use my discretion then to invite Helen to ask her question.
Thank you. In my cabinet role, I sit on the Oxfordshire Health and Wellbeing Board, and on a recent one, we were hearing about the work that's going on with social care in helping people to get out of hospital and continue their care at home, which frees beds, and also it's better for them to be at home if they can be cared for at home rather than in a hospital environment. And I just wondered how that would work in this sort of overlap area, because you're going out of maybe a Swindon hospital, but into the care of Oxfordshire adult social care, and I just wondered how that worked.
Do you want me to answer that one, Gordon? So I think, we already do that now, Councillor Pighill. So it's that for that it won't change in terms of our processes and the way we work. So a change in provider, for example, wouldn't change those flows or those pathways out. What it might mean, in Swindon, actually, just in terms of patients coming out of hospital, we are performing relatively well at the moment. We have struggled in the past with the numbers of patients waiting to come out of hospital when they are ready and medically well to come out. But at the moment, we're doing much better for that. At the moment, we are struggling with ambulance queues, ambulance handover delays coming into Great Western Hospital at the moment, and that's for a range of different reasons, and also having a bit of a spike at the moment with children coming into ED and the urgent treatment centre with respiratory conditions that you'd expect at this time of year. So Great Western is under a bit of pressure in terms of those respects, but in terms of its discharges, it's doing relatively well at the moment, so which is positive.
Thank you, Caroline. Bessia, Councillor Thomas, would you like to ask a question? So in case you haven't met before, Councillor Thomas is our leader of the council.
Thank you, Councillor Foxall. I appreciate you joining us tonight. I really appreciate. I have been involved in the partnership since its instigation. It was called on by the previous members from Shibboleth and Watchfield for the same reason that Councillor Foxall is very interested in this subject. And I represent Farringdon, which obviously is the next ward to the east. But still, we have very close connections, obviously, to the Great Western. But we obviously our GP surgery is very much based in Oxfordshire, and our residents would go to that and be very Oxfordshire based in terms of GP. And I know a lot of this has been covered, and it's very reassuring to hear it. But yes, it's just that connection, as Councillor Pighill was mentioning, between the Oxfordshire services and the Swindon services, which is a very real thing for us in Farringdon, because there is that split. GP services very much Oxfordshire, Bob, and hospital provision is very much with you, and that can be tricky to negotiate. And it's almost like we have an option: shall we go Oxford or shall we go Swindon? And obviously, being at this side of the Vale, it's very important for us to have that really close connection. Whereas Councillor Foxall's, most of her residents probably would be registered with a GP within your service, and that's a big difference. So I was just wondering, and I think I've heard it already, but just reassurance that is a joined up way of working.
Yeah, I think what it is making me reflect on, though, is and Gordon, just thinking about this in terms of our wider relationships as well, is that we haven't reached out done a lot of work with Oxfordshire County Council, and actually it's making me think just in terms of our wider pathways, particularly around adult social care but also children's as well. You know, just making sure that we've considered those links really fully as we're starting to put together the new community contracts going forward. So I think we need to do a little bit more work in that area. I think in terms of the existing pathways, as we said, those won't change, which is fine. But actually, in terms of where Oxfordshire County Council might be looking to develop services, for example, it's up to us to try and make those links across, I think. So that's an action that we can take away from tonight's meeting. So that's really helpful. Thank you.
Thank you. Thank you very much.
Yeah, thank you, Caroline. Yeah, I think that's really important. And actually it feeds into one of my other questions, which was really, how do you envisage working with us as a council? Because it seems to me that actually one of the roles that we can play as a council is we do have this very westward and eastward looking, you know, we are the council that links you with Oxfordshire, as it were. So that seems to me quite an opportunity for us to work together. But also I was thinking about things like social prescribing. Is actually what role can we play as partners with you over the you know, as we shape this new set of services? Yeah,
that's a really good question, Councillor Fox. So I think there is something about the way we've structured our Integrated Care Alliance in Swindon. So our Integrated Care Alliance is the sort of a formal strategic space where we have partners from across our Swindon system, and ultimately it holds the ring on our delivery plan. It's links to the Health and Wellbeing Board, and also it does a lot of this very focused improvement work across our pathways. So I wonder if there's and it's probably something I can pick up with Adriana outside of this forum about whether we can look at, because we're in the process of selecting a new chair, new deputy. We're doing a committee effectiveness review, and we're looking at membership as well. Because you know, that might be one way from an officer perspective to join up, but equally outside of that space, there's no reason why we can't look at you know, periodically joining up some of those other forums where councillors can play in as well. We had a development session a couple of weeks ago, actually, with our Health and Wellbeing Board, and we had some colleagues from the LGA come and present, and there were some fascinating examples of where partnerships are being established across Health and Wellbeing Boards in this new world, particularly where some of these boundaries are blurred. So yeah, I think it's again an opportunity to look at those.
Yes, thank you. That sounds like a really good idea. Judy, did you want to ask another question?
Yes, I just wanted to sort of follow up on the digital side, because one of the things you said was an integrated care record, presumably right across your entire area. I'm not sure. I mean, Helen might be more up to date on that, but I'm not sure whether that's something Bob's actually going to do. And if that's the case, I'm wondering what's going to happen to somebody who goes from Shrivenham to the minor cares unit in Witney and then gets referred to the Swindon Hospital. That's going to cause quite a real sort of challenge to the digital system, I suspect. And I can see it happening quite easily, especially with children. And one of the other things that I think Bob was trying to do was to put digital provision into community centres, and then maybe that being compatible with the health provision, community health provision in that area. And I'm wondering whether you've put that into your plan as well.
Shall I start, Caroline, and you can come in, or did you want to come in? So, Councillor Roberts, that's actually one of the areas I think I would completely agree is, at the moment, I don't think there's a solution to that, if I'm honest, because I think that the NHS in general is trying as much as they can to make the spine bigger and bigger, in the sense that actually nowadays there's quite a lot of information that can be shared through the spine of the NHS database. And in fact, quite recently they've made additional changes to that, where people now have to opt out of having data shared across boundaries and organizations. So this was on Radio 4 actually the other day, the big debate about it. So actually, from a base perspective, I think there's actually now quite a lot of information that can be shared across. I think the challenge comes the lower you go down in that space. So where you have individual organizations that are providing services, they may choose to use specific IT solutions for their own recording purposes. And even if you went into an acute hospital, you'd be surprised. You'd think they've got one system in an acute hospital. They don't. In most cases, they've got several, confusing themselves. So imagine when they're having to work outside. So I think what we need to do is...
I did used to work in the NHS, which is why I asked the question.
Yeah, good. So yeah, not much has changed. So I think there's an opportunity as part of our invitation to negotiate and the procurement process, I think, to be quite intentional with potential providers to say, actually, this is a niche, a unique problem with some of our boundaries. How are you going to look to address that? And get some of those hard yards done in advance, because it's just really hard to do it once people have embedded ways of working, people are settled in, cultures are embedded, and you've got some very smart or rather very anxious information governance people giving you 1,000 reasons why you can't do something. All legitimate, of course.
Yeah, absolutely. I have a question about, Caroline, you mentioned a couple of times in your presentation, you talked about the need to change to ensure sustainability of services. And I was just wondering if you could tell us a bit more about what you see as the key risks or the key services that are under pressure that require change in order to become sustainable.
Yeah, absolutely. So, that's a great question, Catherine, and we've got a much more detailed case for change that we could share if that's helpful. But largely, but some of our modelling is showing that. So, for example, for the number of beds we might need and admissions to hospital for people, that if we didn't change our pathways, that the number of extra beds that we would need, the number of kind of new hospitals and so on, that we would need if we didn't change what we do. It's quite interesting in terms of the amount of funding that we would need to run our services in terms of potential overspend position is quite significant for our local health economy. Whereas we know that if we looked at how we supported people in their own homes, if we helped them to stay healthy, if we helped them to, for example, support with things like healthy weight, healthy lifestyles, all of those sorts of things, which could have a significant impact on rates of diabetes, for example, mental health, all of those sorts of different things. There are a number of different ways in which, if we don't change the way that we deliver our services, we won't be able to afford to provide them in the quality that people need going forward in our local area. I'll see if I can just pick out a couple of examples, because I know you were looking for that. But Gordon, did you want to say anything as well? And I'll just see if I can find a couple of examples.
Yeah, I think it's if you look at the post-COVID world, I think they are patient experiences or people experiences that are happening today, that if you'd said these things would be happening in 2017 or whatever it is, you just wouldn't believe that would be the case. Do you know what I mean? It's like literally the demand is skyrocketed. People are waiting unacceptable amounts of time for things that they should be accessing immediately. It's almost impossible to get a GP appointment or dentist, etc. And you've got ambulance crews, not able to get out to help and support people that have got some serious conditions, etc., etc. We all know that the answer to this is starting to go further upstream, spend less money on that reactive space and start moving the money left into prevention, do more stuff in primary care, do more stuff in our communities. But of course, that requires a seismic change in the way that you structure. And I think this program gives us the opportunity to do that in a considerable way. So, it's exciting that we've got it, but if I'm honest, it's also quite scary in the sense that it's such a big opportunity. We've got to get it right. We aren't going to get an opportunity like this again, where all of our community services resources are going up in the air, and we hope when they land, we've done what we needed to do. Because I don't think that this is the kind of stuff you change with an action plan. It's just too entrenched now, and so a lot of systems won't have the opportunity we have coming at the end of contracts right across the system at the same time to kind of go, right, what are you going to do differently? So we do really, really welcome the challenge that we get from our communities around these conversations, because we do need to push ourselves. And it's not just a financial sustainability thing for me. It's just we're failing people, and that's not acceptable.
Yeah, and I think I'm just looking at a couple of points, Councillor Foxall, if it's helpful. So we know that we over the next 15 years, so the population is going to grow by 6%. So we're going to have an extra 60,000 residents in Bain, Swindon and Wiltshire by 2038. But the critical factor there is that the majority of that is in the 60 plus years, which isn't surprising really given our demographics. And because we know that as people get older, they quite often develop one or more chronic conditions. And that means that we're likely to have an extra, 32,000 people with two or more chronic conditions. But also alongside that, we know that our workforce is changing as well. So the dynamics in our workforce are changing. We have an aging workforce. People are retiring earlier. We know that has happened also because of COVID. That's been a huge impact for us. So all of those sorts of things really are having an impact. And I mean, just one statistic that we have is that our current kind of main hospital activity across our areas costs us about £340 million. But actually, just with demographic changes alone, over the next 15 years, that would see it would go up. We'd need another 5 million a year. And that's before you take into account inflation, the cost of new treatments, new technologies, all of those sorts of things. So if we don't change what we do now, it really, and this is not just BSW either, this is nationally. So, we are heading for a very unsustainable, as Gordon described, a unsustainable position where actually our ability to provide services to our population of a good enough quality would be really effective if we did nothing. That's the do nothing scenario, isn't it? So we've elected not to do nothing. We've elected to do something about it, to transform our pathways, to support people earlier on, to try and do much more case finding so we can diagnose people with those conditions much earlier. That's all part of our plan. is to make sure that we can do that earlier, so we can start treating people earlier. And that's even for things like cancers and other serious life-threatening conditions and diseases as well. And all of that, we think, if you think about the opportunity there is in people's local communities as well, and new technologies that we know are coming over the horizon, there are so many opportunities for us to support people to live longer and more healthier lives. And they don't all cost millions and millions, to implement as well. Some of it is just about changing the way that we work.
Yeah. Gosh. I'm conscious we're at 8:10 now, and we've given you a good grilling. Councillor Roberts, Councillor Gascoigne, have you got other questions you wanted to ask now?
No, thank you.
No. Okay.
Yeah.
Okay. Do you want to, Adriana, is there anything from an operational perspective you're very welcome to ask if you'd like?
Thank you. No, I'm okay. I picked up a few action points for me as an officer to follow up with Gordon and Caroline, so I can do that in our regular meetings. But just from an officer perspective, thank you very much for attending as well. It's been really insightful. I'm looking forward to working with you.
Thank you.
Thank you, Adriana. Yeah, no, I'd just like to second that. Thanks, really. That has been incredibly useful. I've got lots of kind of questions. Can we do this? Can we join? How we work together? And I'm excited and also daunted on your behalf for the challenges ahead. So do keep in touch with us. We obviously we're really grateful for you for your time and your expertise this evening. So thank you ever so much for joining us, and do keep in touch. And we'll send you the minutes of the meeting. I hope that's okay, so that you'll be able to check over the minutes as well, just to check that you're happy with the record of the meeting. This has gone out live this evening, but it may well be that we get follow-ups. Councillor Roberts.
I was just going to say, you did at one point say you wanted to increase or maybe you thought about contacting people at the county council. I wondered exactly who you wanted to, because we have got some I'm a county councillor as well, so we do have some people on the call who might be able to point you in the right direction.
Yeah, was that in reference to our Integrated Care Alliance? Councillor Roberts, I think I was talking about. So our Integrated Care Alliance doesn't have any. I don't think it's got any councillors on it, but it does have council officers on it. Cool. Like the DPH is on there as well. So I think there's an opportunity to do that. But from a councillor perspective, I was just referencing the workshop we had around health and wellbeing boards. Is that there's a lot of cross working now across health and wellbeing boards, and I think it might be an opportunity to bring councillors together in that space around a focused piece of work around our population.
The one question we didn't ask was about the scrutiny, whether you've got health scrutiny bodies.
Yeah. So we do have as health. It's actually combined now. So what the new administration has combined children's adult housing scrutiny into one. So it's quite a big scrutiny space, whereas before we had children's scrutiny separate.
Sorry, can I just? That's Swindon, is it?
Swindon, yeah.
That's the Swindon Borough Council, yeah.
Yeah, Swindon Borough Council, yeah. So, yes, so I think there's a smaller scrutiny that tends to deal with more housing-related issues, but in the main, that's where health scrutiny takes place in the big combined one.
Oh, in Oxford County Council, there is actually a health overview scrutiny committee. So we've just, in fact, done the opposite. We've gone from what was one performance and one health up to, I think, with the latest governance changes, we might end up with 5. So place, performance, and health, youth, and adult and further things. So yes, because the scrutiny agendas were just getting overwhelmed. And so yes, so we've just done the opposite because the scrutiny agendas were too long. So
yeah, I think that's something we should probably pick up over the next 12 months or so, have a look, across the whole area, and see how as councils and different partners we can that accountability, which obviously works both ways, how we can make sure that that's working really effectively and constructively.
Yes, of course.
Yeah, let's do that. Brilliant. Okay, I think let's draw it to a close there. Thank you ever so much for your time, and no doubt we'll be in touch very soon. So thank you.
Thank you for inviting us. Thank you.
Thank you.
No, thank
nice
you.
to meet you all. Thank you.
Thank you for coming.
Thank you.
Thank you, Susie. Can you stop the live stream now, please? Perfect.
Great.